Welcome back, guys. It's Dr. Tom here. Today we are talking all about knee meniscus injuries. So what is the knee meniscus? A knee meniscus injury is damage to the meniscus, which is part of the cartilage in your knee that kind of acts as a shock absorber between your thigh bone and your shin bone, your tibia. You have two menisci in each knee, and you've probably heard medial and lateral meniscus injuries. The role of the meniscus is to absorb impact, number one. It's also there to stabilize the knee. It can help with distributing weight, and it also protects the joint surface. So it stops that bone on bone from happening. And as we wear out with the meniscus and we get osteoarthritis, that's where we can get other issues coming in. What are the main causes of meniscal injury? So number one is twisting, and twisting in sports. So sports where you're on a unstable surface. A big one I focus on is surfing. So a lot of the professional surfers, or even just recreational surfers, will injure their meniscus because with impact, twisting, that can lead to that medial meniscus tearing. The other main cause is degenerative wear and tear. So this is one where I look at a lot of people with their walking biomechanics. If you're walking with your knees in more valgus, which is where, if you're someone who walks with their knees in more valgus, which is like almost that knock-kneed motion, you can get more wear and tear through the inside of your meniscus, the medial meniscus, because that's where that force goes through. So I always explain, it's like a car. If your car doesn't get aligned, there's always one tire that's going to wear out more. It's the same with a meniscus. If you're not perfectly aligned from your hips down to your ankle, there's going to be different parts of the meniscus that start to wear out with age. So if you're someone that's injured your knee and you're not sure whether you've done your meniscus or not, some common symptoms of meniscus can be sharp pain. So sharp pain going into full extension. And you can also have a popping or a clicking sound that generally has pain with that as well. There can be a lot of swelling. So if this is an acute injury, your knee can blow up, get quite big, and also an unstable feeling. So feeling like your knee is going to give out. How do we test to know if it is the meniscus or not? So normally if someone comes into clinic, we'll send them straight for MRIs. There are also orthopedic testing we can do. So a big one is called the McMurray's test. And we can do this if you get a popping, clicking with pain. This obviously means that the likelihood it is the meniscus is high. So if it is a tear and you've consulted, you know that the tear isn't too bad, you don't need surgery, they don't need to do the arthroscope or surgically repair it, what can you do? So rest, ice, compress is obviously number one. We want this swelling stage to go and we want to get to the point where we're able to start to get some movement through it without constantly causing these inflammatory flare-ups. In the early stages as well, your doctor may prescribe some NSAIDs, some basic anti-inflammatories to help with the swelling. Then you come and see someone like myself, an osteo, a physical therapist, a chiro, and we're going to guide you with a bunch of exercises to do some manual therapy work to try and get rid of that inflammation, restore normal range, and strengthen you to get back into what you want to do. And the big one in the meantime will be activity modification. Obviously, you're not going to be doing anything that causes pain. Okay guys, so we're going to break our little rehab plans into two categories today. One is very early. So if you're someone who's acute, this is the early rehab that isn't going to re-aggravate the knee and cause those inflammatory flare-ups. Okay, so with the affected side here, guys, these are called heel slides. And you might want to, I find the best place to do this is on timber or tiled floorboards. Get a little towel, pop it under your heel, and all we're going to be doing here, remember that you mightn't be able to get all the way down to extension, so that's fine, keep within your own limits. All we're doing here is slowly squeezing in, get to the barrier, but don't go pushing through the barrier too much. Slowly going down from there. Just get to where you can. If it's straight, that's perfect. We want all the way down. But if you can't and there's pain, don't push through it. So we're playing within your own. If your limits are literally, if that's it, and that's all you've got to play with, stick with that. That's going to improve over the next few weeks, and we're going to slowly start to push those barriers back. But to start off with these ones, all we want to do is 20 reps, a very slow and controlled heel slides, where we're just starting to, in a safe way, keeping that heel in contact with the table. So that is number one for early phase. Number two, guys, we are going to roll a towel up And this is also an extremely basic, simple one. Depending on how much extension you can achieve through your knee in this early phase, you might want to prop the towel a little higher, but for today we're going to do this. Now this is the same thing. We keep our heel in contact with the table here, and all we're doing is trying to squeeze our knee down into the towel without lifting that heel. So you're trying to squish this towel here, you're going to feel the little muscle on the inside of the knee activate. We're holding here for 5 seconds, then slowly let everything switch off for 3 seconds. So slowly starting to drop everything into that towel, making sure there's no pain. And remember, if there is pain, you might want to prop some more towels in to lift your knee up here, and so you're squeezing down. You can also use cushions, guys. So if you've got cushions at home, you can prop some cushions under there and try and squish those cushions with the knee. So we're going up to 8 repetitions here. Okay, so after you've done your 8 repetitions, what we are going to do from there is depending on how much flexion you can get, we're going to go into pretty much as close to 90 degrees as possible. So you might just be here for now. With our hands, we're gonna lock these around the thigh bone, and slowly with our foot here, and this is extremely slowly because you're gonna get to a point where you're like, oh, it doesn't feel too happy and comfortable there, and we don't want to push through. So you've got to listen to your body today and make sure if you feel pain, you're pushing through too much and you're still a little too premature or too early to be doing some of these exercises. So with this one here, ankle in 90 degrees, making sure we've hooked the thigh bone so it can't move. And then imagine you got a laser beam on the front of the tibia here. We're going to try and shoot that laser beam out and shoot that laser beam in. Now, to start off with, in the first early stage, you might literally be playing with millimeters here. As we get better, we're going to be dropping that foot all the way out, trying to get that shin bone completely going external, and then the shin bone completely going internal. So I'm going to move around in a second. We're going to 10 repetitions here, out and in. And this is just promoting all that scar tissue that's starting to form. So hopefully I don't fall off this table, but you can see here, so my ankle is moving, but my shin bone's facing in a little bit. If you look down, you should be able to see it. And then as you come out, we're trying to get as much movement through there as possible. But if you feel pain, your pain zone may be literally that. So you're sticking within your pain limits. Okay guys, and then for our last exercise in this early stage of rehab, we are going to be over on the mats using resistance bands. So let's jump over there. Preferable a medium resistance band for this one. You can start with a light, but it might be a little too easier. But we're gonna hook this resistance band onto something stable. So whatever you've got at home, the leg of a table, a heavy table preferably, will be best. Then from here, we are going to come out from here. So I want a little bit of tension through the band. We're going to plant all of our weight on the opposite foot. I always like to tell people with this one, as we squeeze this leg straight and go into the exercise, imagine you've got an ant under that back heel. We're not squishing the ant. So all we're doing here is slowly, almost like that towel squeeze before, we're trying to squeeze that leg straight, but we're not putting pressure through this side. All of our weight is through the opposite leg, so the left side for now. So slowly releasing from there after a 3-second hold. We're going up to 8 repetitions here, so slowly coming back. If you can't lock the knee into full extension, that's okay. And if there's pain, you might not be ready for this one yet, but if you're feeling good, let's keep going. And so squeeze back for 3 seconds. We're going all the way to 8 reps here. Make sure as you squeeze the leg back, you should feel that VMO, the inside muscle, the knee stabilizer muscle should be really activated for those 3 seconds. And it's really important with this one to have a slow release just like that. So get your 8 repetitions done. You might want to hold a little longer. If it is too easy, you can always grab the band, step out from there, and then do it from further out. And if this feels way too easy, get yourself a thicker band, and obviously that's going to add a lot more onto it. Okay guys, so now we are in the later stages. You've got more mobility, you should have that full extension back, and there shouldn't be any pain. You should have pretty good flexion. maybe a little bit of pain when you change directions, getting out of a car. If you get your leg caught on the side of a bed or something, you may feel it at that end range, but we're getting there, we've improved. Now we're going into later stage rehab. So what we're doing for one of our first later stage rehab exercise is same thing as what we did in the first, but we're gonna make this a little harder. So we're going all of our weight now into the affected side. We're gonna start here by hinging a little in the hips, bending the knee, and then as we squeeze straight, reaching in front of us. So trying to get this knee all the way back, reach in front of us, and then slowly come back from there with a little bit of bend through the knee. So kicking the back neck out, hinge a little through the hips, almost reaching in front, lock this knee nice and straight, stabilize through it, and then slowly coming back. So make sure that VMO muscle on the inside of the knee is firing. If you need a little something to hold, if your balance isn't the best, make sure that something's close by. But reaching out, kicking the leg nice and straight, slowly coming in. This is gonna get the ankle stabilizers, the knee stabilizers, and the hip stabilizers all starting to work together again, so that when we think about returning you to sport, you're pretty golden. Okay, and just like in the early stage with the bent knee internal externals, we're gonna do that now with a band on. So you're gonna have the band with the foot facing in. You're gonna come out, you can get a little bit of resistance on, but don't sort of crank it with too much yet. Lock your hands around the thigh bone, keep the about 90 degrees through this ankle, and we're going to be squeezing in, slow release from there. So all the way to 8 reps here, keeping it very slow, ensuring there's no pain, and sticking within your barriers. By now, in this later stage, we should be playing with a lot more range through this one if you've been doing it in that early phase rehab. And this is going to really help you when you get back into activity. So whether it's sports or just everyday walks or whatever it is, this one, that little bit, we've got rotational force and the meniscus generally doesn't like it. And this is the motion that it needs to get better at. This is gonna really help it. It's also gonna help break some of that scar tissue up. So once we've done the 8 reps there, guys, we can come out. Okay, so what we're gonna do here, guys, is into knee extension. So lifting from here, holding the knee straight for 5 seconds, toes pointing towards the ceiling, and then slowly releasing from there. So we're going up to 10 repetitions here. Now, if this is pretty easy, you can get a little ankle weight around your ankle. So there shouldn't be any pain with this. As you come out straight, should be feeling once again that VMO, the knee stabilizer muscle on the inside should be firing, and down from there. So I'll give you a little idea. If it was doing it with the left side here, kicking it out straight, holding, this knee should be completely straight here, holding up there, and then very slowly controlling the down phase. So try and get your 8 repetitions done there. There shouldn't be any pain. That's a great exercise for you guys. Okay guys, and for the last exercise for today, we're gonna use the fitness ball to do some hamstring curls. So why work the hamstrings? The hamstrings control everything down. So when we're jumping and landing, when we're walking down a hill, when we're running fast and slowly decelerating, the hammies control all of that. And if we want to control the amount of load we're putting through the knee, then we want to strengthen the hammies. If we focus on quads all the time, that's going to just make the knee more compressed and put way more strain through the knee. So balancing between the front and the back structures is extremely important. So all we're doing here is lifting the hips an inch off the ground, slowly go out into a straight knee position, and then slowly squeezing in as close as you can get it to the bum, ensuring that there's no pain. And all the way to 10 repetitions here. As you squeeze in, try and keep those glutes tucked. Heels trying to pop the fitness ball, and those hammies should be feeling it. Now, after you complete 10 repetitions here, what we can do as well is bring the ball all the way in, hands out on the ground, and then from here, we're gonna finish with a little isometric hold. And this can just be 20 seconds of trying to squeeze those heels as hard as you can. Lock the ribs down, lift the ball off the ground a little bit. Make sure everything's activated. Squeeze those heels as hard as you can, and you're gonna get a shake in the legs. And after the 20 seconds, you can slowly come out from there. And we finish with that isometric hamstring hold. I really hope you liked today's routine. Make sure you write in the comments section if you're finding benefits from using it or if you want to see anything in the future. But until next time, guys, take care and we will see you again soon. Thank you.